Welcome to this episode of Case Bites brought to you by Schein. I'm Dr. Michael DeFee, and today we're going to talk about 3D printed inlays and onlays. So for those of you who don't know me, I'm the co-founder of the Mod Institute with Dr. Wally Renee in Charleston, South Carolina, where we are super passionate about 3D printing and the power that it can bring to your practice, both from an efficiency standpoint and also from a patient outcomes standpoint. So this is our facility in Charleston, South Carolina, where not only are we doing education, but we're also practicing dentists, where we're putting into practice the workflows that we're teaching every day so that we can ensure we stay on the cutting edge of what's happening in dentistry. And so many of you probably have heard about 3D printing. Maybe you're doing a little bit of 3D printing in your office. Maybe you want to do a little bit of 3D printing in your office, but you're kind of nervous. But I want to tell you that 3D printing has touched and changed every part of my clinical practice, from veneers to inlays and onlays to crowns to surgical guides to night guards to All-on-X prosthetics. There's not a part of my practice that hasn't changed for the better as part of incorporating 3D printing into my workflows. But today we're going to focus a little bit on inlays and onlays and how 3D printing can change what you're doing there. So the first thing I want to talk a little bit about is what 3D printed resins are and why we shouldn't be afraid of them as definitive prosthetics for our patients. So in this slide, we're looking at really three sister materials where the base chemistry is pretty much exactly the same. Direct composite to milled composite to 3D printed resin ceramics. The base chemistry is all the same. We've been delivering these types of restorations for our patients for many, many years with success. But manufacturing them using 3D printing, it improves the mechanical properties, and it also improves the efficiencies and just the level of anatomy and contours that we can get in our restorations in a way that's just more predictable than it has been in the past. And so for 3D printed restorations, as we take that chemistry and we just design and manufacture these restorations in a little different way, we're able to manufacture at a speed that you just can't do with 3-axis milling. 10 crowns in 10 minutes. The mechanical properties are great. Elongation at break, strength, fracture toughness, which is we know is the most clinically applicable in vitro mechanical property that we can look at. And so this study, what they did was they looked at 3D printed crowns, they looked at V-dynamic crowns, and they looked at EMAX crowns. And they compared ultra-conservative type restorations to see what the fracture load was to cause failure. And so looking at 0.5 millimeter, we see that 3D printed restorations, the fracture was about 570 megapascals. V-dynamic and EMAX CAD, they didn't even meet the threshold to be measurable. And when we look at 1 millimeter and 1.5 millimeters, what do we see in that 3D printed column on the left side? We see that it is as good or slightly better than both V-dynamic and EMAX CAD, which are probably restorations that you've been doing in your practice with a lot of success. I know I've had tons of success with EMAX restoration, a really great material. So we know, looking at these mechanical properties, that the 3D printed crowns or inlays or onlays, they're as strong as restorations that we've been delivering for a long time. And so one of the things that changed at the beginning of last year is the CDT definition for what a ceramic type restoration could be coded as, is that 3D printed restorations containing over 50% inorganic filler can be coded as ceramic. And so there's a few of those that are on the market now. Sprint Ray Ceramic Crown, Rodin Sculpture 1, Rodin Sculpture 2, with several others that are probably coming to the market in the coming months. So we know, even if we're insurance-driven practices, that we can build these out and be reimbursed at a fee that is both, economically feasible for us to do these restorations in our practice. And so there's a few printers on the market that have validated workflows for these types of restorations: Accurata Soul, Sprint Ray 55S, 95S, Asiga Max. But in this video, we're going to focus in on the Sprint Ray Pro 55S and utilizing their crown kit to be able to print these restorations really at an accelerated pace. And so this is our case today. So this is a patient with a lot of failing direct restorations, large composites in the posterior where we've got recurrent decay, probably like a lot of patients that you've seen in your practice where, the hygiene is not quite what it should be. Maybe the bond strengths are breaking down. They're older restorations. And so we've got a rubber dam on, we've got everything cleaned up and prepared, and we're ready to scan and do our design of our restorations. And then we send those out to print. And so this printed, the timer said 10 minutes, actually printed slightly faster than that. With a quick spray wash and cure, we're ready to start delivering these at about the 15 to 20 minute mark, which for 3 large restorations like that, trying to do that with a 3-axis mill is probably not going to be able to deliver the same level of efficiency. So there we have those printed on the build plate. You can see the beautiful detail, properly supported. We've got the intaglio facing up so that we're not going to have support tips affecting the fit of our restorations. And so there we are starting to deliver those intraorally. Once again, these types of restorations need to be bonded, so you need to be using isolation. Our preferred method is rubber dam just because of the absolute isolation it affords us. A lot of times we like to deliver these with the supports on and do our characterization as far as occlusal anatomy after it's bonded in place because they can be really small and hard to manage. So we started here and we finished the case here. And so that was roughly about a 2-hour appointment in our office. Probably could have been slightly quicker if we weren't, taking as many photos, but 90 minutes to 2 hours is totally reasonable to do these types of workflows in your office, maybe even faster for some of you guys who prep a little bit faster than me. And so this is what we look like the day of delivery. You can see really beautiful marginal integrity, really kind of almost disappear into the tooth. And that's one of the things that I really love about 3D printed restorations. And here we are at about the 9-month mark post-delivery. And so we lost a little bit of the sheen that we had on the tops of the restorations, but most of the staining still present. Marginal integrity still amazing. So we don't have 5-year follow-up on these types of restorations, but I will tell you that what we're seeing in our practice, very, very promising for long-term survivability. And so looking at the ROI for these types of restorations, we're looking at, like I mentioned, 90 to 120 minutes for these appointments, both prep, scan, design, bond, and finish delivery. Doctor time should really be about 30 minutes or whatever it requires you to prep and then bond these restorations in place. The rest of that should be delegated, whether you're doing design in office or you're sending out for design, you have a designer on standby. The cost to print these restorations, so for these 3 that we just looked at, it was about $2 in cost of resin. Cost to patient, anywhere from probably $1,800 to $3,000, depending on whether you're billing insurance for this or whether you're fee for service and where you are. But definitely a huge ROI to be able to deliver this type of care efficiently for our patients. And what we really need to think about here is patients love getting in and out of our chair as fast as we can. And so being able to do all 3 of these that quick and deliver a restoration that I'm proud of is something that's very, very exciting for me. If you want to learn more about these workflows, we teach these types of workflows in our 3D printing track in our level 1, 2, and 3 classes. Please join us in Charleston, South Carolina. And so thanks again for tuning into this episode of Case Bites brought to you by Schein. I'm Dr. Michael DeFee. If you want to reach out to me, if you have questions, if you just want to share your cases, which we love to see successes for 3D printing cases, please email me or follow me on Instagram and send me an Instagram message. I'm super excited for you to start integrating some of these 3D printing workflows in your practice and see the power that it has to just change the way you think about dentistry the way it has for me.